My name is Karen McDaniel, and I am the Director of Medicare Operations and Compliance for the Senior Care Products Division, Senior Care Products Department at URL Insurance Group. And today we're going to be going over the tools that we're going to have made available to you to help you have an extremely successful 2016 AEP. We're going to be focusing primarily on our website and everything that's going to be on there to be of assistance to you. So the agenda right now, as you can see on your screen, we're going to be going over the product information page, the quote engine, our 2016 AEP resources, leads, what we are going to be having new for 2016 on the website, who to contact, and then also, most importantly, our 2016 Medicare Connections conference. So we'll get it started, and we'll go to the home page of our website. Now, if you are currently an existing agent with URL and are submitting business, you will have a username and password to get into the website. If you are not an existing agent, there are some pages on the website that you are not going to have access to. So once you are an existing agent, you're going to log into the website right here where it says Agent Login. And for the Senior Care Products, you'll go to Senior Care Products page. And from there, you'll see myself and the other two members of our staff, Alyssa Panaya and Janine Kramis. Right now, we're going to be hiring another person for the department, so look out for an announcement regarding her hire in a couple weeks. And her picture will be here as well with her contact information. First, we're going to start off with product information pages. These pages are going to have all of the carriers that URL currently contracts with. And right now, for the Medicare Advantage and Part D carriers, the content that's going to be in here is going to be the 2015 content because, as you know, the 2016 content is not available yet, and it will not be available to us to add to the website until October 1st. So anything on here is going to be 2015, but as soon as we get it from the carrier, it will be updated. So we'll just go to the Geisinger page. If you look on the Geisinger page, you're going to have any of the information that's made available to us from the carrier. So the summary of benefits, if an application is available to us, we'll have an application that you can open up, you can print it out, and that's perfectly acceptable to use in place of the application that you would get in a packet. Fax cover sheet, if it's applicable to the carrier. Contracting information, if you're not contracted with the carrier, if you have not filled out a flash licensing packet, it's an easy way to contract multiple carriers. And then also any contact information for the carrier, broker services, enrollment fax number, customer service, and any addresses if it's necessary. Scope of appointment is going to be on all the pages and how to complete the scope of appointment. We typically only put the generic scope of appointment form on here that is perfectly CMS compliant. There are some carriers that do require you to use their specific one, but as long as you have anything that the MS approved, you can use that in place of that. Medicare supplement, their rate change every once in a while, so we try and we always keep up on the forms for that. Highmark, it's going to have the central rates. So those are the newest rates from January 1st of 2015, and then the application. Next up, I'm going to go over our quote tools. And our quote engines have recently received a little bit of a facelift. Our Medicare Advantage quote engine, you just type in a zip code. It's going to automatically populate the county. It's going to pull up whether you want a Medicare Advantage plan, a Part D plan, or a special needs plan. And you can set it by price or AM Best rating or Standard & Poor's rating. You can type in a client name and get the quote. And from here, it's going to sort it by price. So you'll see all the zero premium plans first. It'll go with the name, and then all the way down to the most expensive plan. And then you can also export this. You can export it, you can print it, you can save it as a PDF, you can save it as an Excel spreadsheet. Medicare Supplement Quote Engine. You can do a little bit more with this. CMS does not allow you to print out side-by-side comparisons of the Medicare Advantage. So for the Medicare Supplement, again, the county will be automatically filled in. The age, 67, gender will keep as male, tobacco, plan F, sorted by price, 7/8 effective date, and client name is optional. Click on Get Quote. And then you'll see all of the Plan F plans that are available. Also with the Medicare supplement, you can add underwriting data. So if you know that somebody has had congestive heart failure in the past 2 years, you can click on congestive heart failure and it will let you know what applications will tell you they can't have that certain condition within a certain amount of time, so you know that that plan is probably not going to be a good fit for them if they have to go through any kind of underwriting. If there's any questions during the webinar as well, you can also type in the question box and I can answer it at the end. And then the next thing we're going to go over is our 2016 AEP Resources. This is where we're going to be putting any of the certification information as we get it from the carriers, any of our 2016 Medicare newsletters that have gone out. So we had one that went out 2 weeks ago. We had one that went out yesterday. That needs to be added to here. But they're all going to be archived. So any of the information that we send out is all going to be here. As you can see that we had the 2016 Cigna Health Spring certification was announced. So was the AHIP and the United Healthcare certification. Coming up, you'll see some announcements from Aetna Country. They're going to be releasing their certifications tomorrow. Again, all the certification information will be able to be found at this 2016 AEP Resources page. Next is our LEAD program, and if you click on the LEAD program from any of the department pages, it'll take you to the Life Market LEAD program and the Senior Care LEAD programs. So if you click on the Senior Care LEADs, it's going to give you the contact for all of the LEAD vendors that URL currently works with. We will be offering leads during the AEP. So if you would like to receive some of those leads, we would just need to know from you what counties you would prefer them to be in. And as we start getting them in, probably closer to the end of September, early October, we will be distributing them to you. Obviously, the more that you respond to us, the more we're going to be able to give to you. So the faster you're able to work the leads, the more we're going to be able to give out to you. But if you would like to place your own direct mail leads, this is the place where you would find any of the carriers. You can certainly give one of us a phone call or an email, and we can help you try and determine what you should be speaking to the lead vendors about as far as zip codes or counties and income ranges, what lead piece is working best for them right now. And new for 2016, we are going to be adding a supply order form to our website, and this will hopefully help you streamline your supply ordering process. I know that each carrier has their own kind of different nuances when it comes to placing a supply order, and it can be sometimes confusing, and a lot of the websites just aren't very user-friendly because we do it so often. is a little easier for us to kind of navigate through the website. So if you're finding yourself having a hard time logging into some of the carrier websites, ordering the packets, we're going to have an order form on our website that you would just fill out, and then we will get the email to go ahead and place the order for you. You will need to be contracted with the carrier in order for us to place the order. But once we get that, and we will then confirm with you that we have the order, it's been placed for you, and if at all possible, your contact information, your email or phone number will be added to the supply order. That way you get the email directly from the carrier so you know that the order has been placed. Another exciting thing is the Part D penalty calculator. And right now it's just in kind of like a little beta stage, but this is basically what it's going to look like. I know I get a lot of questions of if somebody didn't pick their Part D plan when they were first eligible, and now 5 or 6 years later they want to enroll into a Part D plan, how much is their penalty going to be? So you would simply type in, and since Part D was only introduced in May of 2006, if somebody was eligible in May of 2000, it would automatically default 2006 because the penalty won't go past that year. So if you put in that you have a client who was eligible for Part D in October of 2004, and they're now only going to enroll into Part D in August of 2015, and you calculate, so the estimate is going to be about $36.63 for their Part D penalty. Now this is just an estimate, and we encourage you to please relay that to your clients that it could be a little bit more, it could be a little bit less. That's it's going to be dependent on CMS and the carrier. They're going to be the ones who give the ultimate determination of the penalty. But this will at least give them an idea of how much they can expect to be tacked on to their Part D premium. Who to contact during the AEP and the rest of the year, really. For contracting, our 1-800 number is right up there. Tish Weitzel is our Director of Contracting. Her email address is there and her extension is 124. Jessica Badillo is one of her assistants, and Judy Warner as well. They'll be able to help you with any of the contracting. If you don't have your contracting submitted now for any of the carriers, it's probably a good idea to start considering maybe getting that paperwork started. Once the AEP starts, the carriers do get very backed up, and we would hate for you to have clients waiting for you to enroll them into a plan and you're waiting for contracting to be completed. For commissions, Brandy Coleman is our Director of Commissions. And our Senior Care Products Department, it's myself, Melissa Panaya, extension 149, and Janine Kramis, who is at extension 112. And then our Medicare Connections Conference. This is our second year for our Medicare Connections Conference. It's going to be held at the Hershey Lodge on August 27th, starting at 8 o'clock until 4 p.m. We're going to be having 5 carrier partners there: Capital Blue Cross, Aetna Coventry, Gateway Health, Geisinger Gold, and Heim Medicare. They will be presenting their 2016 plans, and this is a really great opportunity for you to have face-to-face time with each carrier to ask them your questions. If you've had any issues in the past with your clients and certain plans, this is a really good opportunity for you to be able to voice those concerns to the carriers. It's a great networking opportunity to learn about new products, learn different selling techniques from other agents that are there. We're also going to be having Joe Corio from our annuity department. It's going to be making a brief presentation regarding annuities for seniors, and then also Steve Clemens from our life department will be there as well, talking about final expense. Really great opportunity. We encourage you to attend, and you can register for that by going to the website, our website, clicking on the 2016 AEP Resources, and clicking on Register for the Conference. type in your first name, last name, email address, and phone number, and that will get you all registered for it. I do have a couple questions here. Let's see. How accurate is the underwriting section in the Medigap quote engine? Well, Steve, the actuarial company that works on our quote engine works directly with the Medicare supplement carriers. I always, anytime I'm still going through an underwriting question, though, I still do review the paper application just to double check. But it's pretty accurate. I mean, it's going to tell you how long somebody can be, how long somebody has to be diagnosed with something before they'll accept them for underwriting. So, I mean, it's not going to tell you for sure if the person's going to be declined, but it's going to tell you that, well, you know, if somebody has congestive heart failure, they can't have it within the past 2 years. So it's pretty accurate. Do I know when Aetna will be sending out the AHIP Front Runners program? Sean, it's probably going to be sent out tomorrow with the release of the rest of the certification. I would anticipate you receiving the information for that if you were a front runner. Will CBC allow agents to sell their Med Advantage plans for 2016? We do not know yet. We're hoping, but we don't know. It's hopefully something they can maybe discuss during the Medicare Connections conference. So that'd be a good opportunity for you to find out there. Any chance we can tie in the certification class the next day? Bob, I don't think that's going to be possible. We are actually moving buildings, and I think that Friday is going to be the day that we're going to be doing that. So I don't think we'll be able to tie in the certification class that day. Some of you in the past have attended our certification classes. We are waiting to hold those until we are into our new facility. One, we'll have more room, and two, we really want to make sure that all the carrier certification is available. Last year, we had a couple carriers who the certification was released and then they had a couple updates and it was very confusing. So we want to make sure that everything is ready to go. We have heard from a couple carriers that their certification will not be released until mid-August. So we want to make sure that everything is available first before we start holding certification classes. So we are not anticipating anything until mid-September or early September for certification classes. Is any company reimbursing for AHIP? The only carrier that is going to be offering any kind of reimbursement for the AHIP is Aetna Coventry. Then that is called their Front Runner program. And you would have gotten an email directly from them if you qualified for that about 3 or 4 weeks ago. Their requirement was that you sold 15 Medicare Advantage or prescription drug plans during the previous AEP. So if you did not get that email, then you did not qualify for that. United Healthcare is doing a discount for it. If you took the AHIP direct from the AHIP website, it's $175. If you took it through United Healthcare, it's $125. Coventry will also be offering the discount as well at the $125, but only the quote-unquote front runners are going to be receiving it for free. Are all MAPD plans accepting AHIP for 2016 PA certification? Russ, we don't know yet. Because not everybody has released their certification information, I can't say for sure, but I would say it's a pretty good bet that they will still accept the AHIP. Highmark, I know that they do their testing through Gorman. In the past, they have accepted AHIP, so I would assume that coming this year that they will accept it as well. Will Highmark Medicare Advantage plans be available in northeastern PA? Barry, I believe you're referring to the merger between NEPA and Highmark. We're not sure yet. The only thing that we had heard from Highmark was that the folks that are on the NEPA Medicare Supplement Plan will be rolled over to the Highmark Medicare Supplement Plan. Not sure about the Medicare Advantage yet. Are we going to get a sneak peek of Coventry's Advantage plans? Yes, as soon as we get it from Coventry. Capital Blue Cross just lowered their premiums for their supplement coverage. I do not sell CBC yet. Do I just fill out their application to sell the supplement for the remainder of 2015? Will I also be tested to sell just the supplement and then again to sell it for 2016? Capital Blue Cross does not require any certification for their Medicare supplement plan, so you wouldn't have to worry about that, Jim. As long as you're contracted to sell their Capital Blue Cross individual plans, you're able to sell their Medicare supplement plans. They do just ask that in place of your standard Capital Blue Cross writing number that you use your national producer number instead. So to get to the Capital Blue Cross for their application, you would just go to the product information page and go to Capital Blue Cross. And here's all the forms, the application, and the new rates for an 8/1 effective date, and they have gone down. Are carriers accepting United Healthcare basic certification? No. United Healthcare has their own Medicare basic certification. It's only good for United Healthcare, but United Healthcare will accept the AHIP certification. Will the Humana and Aetna merger have any changes for the 2016 year, or do you think that will be in 2017? Tracy, I did just receive an email from Humana. They are going to be operating as two separate companies for 2016, so I would not anticipate seeing any changes until 2017. And Ted, I believe you missed the part. Will CapBlue open the MA to us? Not sure yet. I know that there has been rumor about it. We're not sure yet. And are the central rates with Highmark MedSups good in NEPA? Jean, not sure what you mean by that. I can give you a call after the webinar. If there's any other questions, go ahead and type them in now. If not, that is all I have for you folks. Again, I encourage you to register for our 2016 Medicare Connections Conference. A lot of valuable information will be available to you for the 5 carriers that are going to be there, as well as Joe Corio and Steve Clemens from our annuity and our life departments. If you have any other questions, please feel free to reach out to myself, to Alyssa, to Janine, and we'd be more than happy to help you. We will look forward to working with you now and during this upcoming season. Thank you and have a great day.